A scathing new report says Ontario was not ready to address the pandemic and had no plan to protect people in long-term care. The findings are from the final report of the province's Long-Term Care COVID-19 Commission, an independent body that's been investigating the spread of infections in facilities across Ontario. Natalie Kalata is on the story for us this morning and joins us once again. So what more can you tell us about what is in this final report, Natalie?
Well, it's a long report, over 300 pages long. In the report, the experts interviewed over 700 individuals to come up with their findings. What they looked at and what they found were both actions and inactions from the Ontario government that they say contributed to outbreaks at long-term care homes across the province of Ontario. We know some 4,000 people died in those care homes, 11 staff as well during the outbreaks. Now, one of the things that they said is they sort of summarized some of the issues. Take a look here in the report. We have an excerpt to show you here. It says many of the challenges that have festered in the long-term care sector for decades, chronic underfunding, severe staffing shortages, outdated infrastructure, and poor oversight contributed to the deadly consequences for Ontario's most vulnerable citizens during the pandemic. This was from the commissioner of that report. Also important to note, they say this province was slow to act in March 2020 when the outbreaks began. They say the government had yet to formalize a structural response, and they continue to say that without an established practiced plan in place, the government found itself making up its emergency response as it went along. Now, the report also continues to go on to say that the province's top doctor at times was ignored, that they repeatedly ignored warnings from scientists, from local public health units, even the Minister of Long-Term Health occasionally saying that in some cases the government acted before consulting with any of those. John?
So, Natalie, what kind of reaction are we getting to this report?
Well, as you can imagine, it's rather critical. It's rather wide-ranging. The union represents thousands of healthcare workers in the province of Ontario, said that, this iron ring that Doug Ford really talked about putting around long-term care homes was more of perhaps a PR slogan than an actual plan. So lots of talk now about reforming the system in its entirety. John?
Thanks for this, Natalie.
You're welcome.